Well, it's been an interesting time in the last 2 years in patients who have atrial fibrillation who need to go under PCI in getting new data to help address what should be the antithrombotic mix. And following the WOOS trial, we have done studies where we dare to stop aspirin, and that looks like it's a smart answer. The concept is that using triple therapy with aspirin, a P2Y12 inhibitor, and an anticoagulant is needed for the atrial fibrillation and the stent, and yet it leads to a lot of bleeding. And so the idea is, could you take away the aspirin and have less bleeding and still get away with that from a thrombotic point of view? And the answer seems to be yes, so that WOOST and Pioneer AF and then Redual PCI all found less bleeding when you take away aspirin, and so have dual therapy with a P2Y12 inhibitor and, in the latter cases, a novel oral anticoagulant. Fortunately, the thrombotic events don't seem to be increased even when taking away aspirin. So you use aspirin obviously before PCI in the hospital, but then at discharge stop it. And we saw in Redual PCI like 30 to 50% lower risk of major bleeding and similar rates of thrombotic events. We studied dabigatran in Redual PCI, and the approved dose of 150 milligrams had just identical rates of stent thrombosis, MI, etc. So full dose anticoagulation, P2Y12 inhibitor, usually clopidogrel, although we had some ticagrelor, but then no aspirin, and the outcomes were really terrific. And so a recent North American consensus statement, I was a part of it, about 15 of us, did note that with now 3 trials showing this, that this could be sort of the default strategy, that after or at the time of discharge that you'd send people home on the dual therapy and allow risk stratification if you had a high thrombotic risk, a left main stent or something. I think maybe a month or more of triple therapy, but to really shift towards this dual therapy as the default. And so we'll see how that plays out. There are some new trials coming, but that does seem to be a nice advantage that we can offer to patients and really reduce bleeding for them.